Every year in this country, nearly 17,000 Americans are diagnosed with cancer of the esophagus, a disease that is 3 to 4 times more common in men than women. Today, our medical specialist, Christy Kruger, looks at how a less invasive surgical approach to removing damaged areas of the esophagus is actually making a difference for patients.
For years, William Scharf has struggled with acid reflux.
It's a burning feeling, and it goes all the way up and you can feel it in your throat.
Over time, it took its toll on his esophagus to the point where he developed cancer. Following chemo and radiation, William underwent a procedure at Mount Sinai Medical Center to remove the damaged section of the esophagus.
There are many different ways of removing the esophagus.
Traditional surgery requires large incisions in both the chest and the abdomen in order to remove and then recreate a section of the esophagus.
Esophagectomy is one of the hardest operations that we perform, in the sense that we have to enter a number of body cavities. So you have to be in the chest, sometimes you have to be in the neck, sometimes you have to be in the stomach.
Mount Sinai oncologist Dr. Kafir Ben David is working with a less invasive approach that can accomplish the same results through smaller incisions.
And the advantages of doing it that way is that the patient's recovery is much quicker, so their length of hospital stay is much quicker. They return to their normal activities much faster, and the risks from the operations are a lot less.
3 weeks after surgery, William's voice is still a little raspy, but he's feeling good.
I'm just amazed how fast I've recovered.
Esophageal cancer makes up about 1% of all the cancers diagnosed in the United States. Lifestyle risk factors include things like smoking, drinking alcohol, obesity, or eating a lot of processed foods. With your health news, I'm Christy Kruger, Local 10 News.
And that's going to do it for Local 10 News.